Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I am also an IBCLC. I am maternal newborn nursing certified and have received training in perinatal mood and anxiety disorders and perinatal bereavement. A common concern amongst women who are providing breast milk to their babies, either by direct breastfeeding or pumping, is, do I have enough milk? When the answer is no, they seek out quick fixes to the problem. A common quick fix is a Galactagogue. Galactagogues are natural herbs and foods that are used to increase breast milk supply. Let's explore what the common Galactagogues are and see if they really work. Galactagogue is a fancy word for something that helps increase a woman's milk supply. Generally, it refers to foods and herbs that can increase milk supply, but a pump or effective pumping schedule are technically also galactagogues. This term has Greek origins, with galact, which means milk, and ogogue, which means promoting or leading to. Not every woman needs to use a galactagogue, and they certainly shouldn't be used in the first week after birth. Most women do not need galactagogues if they are exclusively breastfeeding and the breastfeeding is going well. Additionally, if a mother is pumping for whatever reason, with a proper pumping schedule, a galactagogue should not be required. In other words, there is no need to add something if things are going well. Adding a galactagogue when it is unnecessary can lead to engorgement. Engorgement can lead to plugged ducts and mastitis, and this is not a fun road to go down. There are many foods that have been anecdotally shown to increase milk supply. However, there are not a lot of studies to prove or disprove these findings. In my opinion, foods are the safest galactagogues to use because there are things you might naturally eat anyways. Foods that may increase your milk supply include oatmeal, ginger, garlic, barley, green leafy vegetables, brewer's yeast, brown rice, nuts including almonds, spices like cumin and turmeric, chickpeas and lentils, beets, yams and sweet potatoes, carrots, green papaya, sesame seeds, and flaxseed. Ultimately, having a healthy diet encourages a good breast milk supply. Make sure you're getting enough protein and high-quality fats. Additionally, drinking fluids, especially water, is good for making milk. Drinking fluids keeps you hydrated, which helps, but drinking extra water will not increase milk supply. Additionally, drinking milk does not increase your milk supply. Some foods to avoid because they've anecdotally been shown to decrease milk supply, including mint, especially peppermint, parsley, sage, oregano, beer, alcohol, and the overuse of topical cabbage leaves for engorgement. There are many herbs that have been anecdotally shown to increase milk supply. However, there are not a lot of studies to prove or disprove these findings. Herbs need to be cleared by your baby's doctor if they are in the hospital due to prematurity or a medical condition. Other herbs put you at risk for negative side effects, including miscarriage. Ultimately, herbs should be used under a healthcare provider's guidance. Herbs that may help increase breast milk supply include fenugreek, dandelion, alfalfa, milk thistle, blessed thistle, anise, stinging nettle, fennel, and goat's rue. I personally consider lactation cookies, teas, essential oils, and supplements all to be in the category of herbal galactagogues. Teas and supplements definitely rely on herbal components. However, lactation cookies often contain herbal components as well. Be aware of what you are using before you use it. Herbal supplements are not regulated in the United States, and therefore the concentrations and quality can vary from brand to brand. I will briefly discuss two prescribed medications that can increase breast milk supply. However, they are rarely, if ever, used in practice. The first is domperidone or Motilium. There are reports and studies all over the internet touting the effects of domperidone and its ability to increase breast milk supply. It does work, however, this medication is banned in the United States after studies showed a potential for fatal cardiac rhythms. It is regularly used in Europe and the Caribbean, and some mothers will attempt to obtain it from Canada, but it is not recommended for use. The second medication is Reglan or metoclopramide. Reglan is commonly used for nausea. However, it has been shown to increase prolactin levels, which helps boost milk production. The problem with Reglan is that it also has been shown to increase the risk of depression or depressive feelings. Therefore, Reglan is not recommended for use in any mother who has a history of depression or postpartum depression. Additionally, the mother should be screened for a mood disorder prior to receiving the prescription and should receive close follow-up throughout its use. Galactagogues work best when you are doing all the things that make breastfeeding work. This may not make sense to you, but it really is true. Your body needs the appropriate strong signals for producing breast milk to utilize the Galactagogue. So, if you're experiencing a low milk supply, try to work on these things first. Ensure you have a good latch because a poor latch will affect milk supply. Poor latch could be indicative of other problems like tongue tie, which could also affect your milk supply. Ensure pumping is going well. Problems with pumping could include the wrong pump settings, the wrong pump, poor flange size, or the wrong pumping schedule. Practice lots of skin to skin. Try to reduce stress. Make sure feedings and pumping is frequent. Try hands-on pumping, which involves manual expression and massage prior to and after pumping. Work with a lactation consultant so they can evaluate the whole picture to identify any areas of breastfeeding or pumping that can be improved. Some things to avoid that can inhibit milk supply include smoking, wearing tight-fitting bras, and taking over-the-counter medications like antihistamines, which can dry up your milk supply. Running to a Galactagogue for low breast milk supply should never be the first step to increasing breast milk production. Good evaluation from a trained professional like a lactation consultant can go a long way to improving supply as well as your confidence. However, when modifiable factors have been addressed, a Galactagogue might be the solution. I hope this has explained the use of Galactagogues and informed you of the most common ones to try. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.